Okay, so Dr. Shoshani, New York City chiropractor. I'm here with Elisa. She's a returning patient. How long has it been since we haven't seen you?
A few years.
Okay, so you're seeing another chiropractor. We're not going to mention names, but you weren't getting the results. So you decided to give us a try again.
Yes.
All right, cool. So most of it is lower back.
Yeah, lower left.
Lower left hip. And also some going on in the neck.
Yes.
All right, so let's look at your range of motion. Turn your head to the left. Just turn this way. Good range of motion. Turn your head this way. Very good. Back in the middle. Chin down to your chest. All the way down. There, going down. Okay, good. Come back into extension. All the way back. Pretty good. Okay, great. Let's go face down on your stomach. Got some fresh face paper for you. All right, so I'm going to start out with a leg check to see what's going on. Okay. So chiropractic leg check, left, short leg on the left. Stays short, so we have what's called a negative gear field on the left. Usually indicates something going on either with the lumbar spine or SI joint on that side. We're gonna do our leg lift test. We're gonna have you keep this knee straight. You're gonna lift this leg straight up like this. Okay, put it down. Lift the right thigh straight up. Good, put it down. Left thigh straight up. You can see that. Put it down. You can feel that too, right?
Yeah.
What side's harder?
The left.
Left. Pretty obvious. Let's show that again. Right side. Flies up. Put it down. Left side. Yeah, a lot harder. So we're recruiting a lot more muscles. There's not a little bit, but a big imbalance there. So we get in here and palpate. So anything going on right down in here in this left side?
Yeah, I feel it.
So more like a lumbar, okay? All right, so what you're gonna do is called a challenge, which is I'm gonna put it in the direction I wanna put it, and then have you lift that leg up again, lift that right leg up, and put the left one up. Not really that much different. A little bit easier, about the same. What do you think?
Yeah, a little easier.
Okay, so we're gonna adjust that fifth lumbar on the left. Let's have you laying on this side of your body. Okay, so it's been a couple of years, so remember, I move bones. So you're gonna hear it, you're gonna feel it, and you're gonna turn around to the other side so you can come closer up the front. Okay, great. This goes here, nice and straight. So the camera doesn't really pick up sound, but we're getting there. Take a nice deep breath in, and let your air all the way out. Don't help me. Down. Good. You okay with that?
Yeah.
Let's go face down. We want to have you see the difference in the ability to lift that leg up. Should fly up. Let me take that pressure off that nerve down there. Left leg straight up.
Oh, wow.
Oh, wow.
Yeah.
A lot easier
Yes.
just by doing that one move. Okay. Do that again. Yeah, a lot easier. Okay, good. So we're going to come back down to the leg length. Boom. That's beautiful. Okay, cool. So also, were you having some issues with the opposite SI joint, or that was pretty good?
It was better, but it's still tight. Yeah, it's not painful like the left, but it's tight.
Well, we don't just want to crack everything, just the sense of cracking it. We want to adjust what needs to get adjusted and let the rest slide. So I think that was such a good correction that instead of putting you in the side posture, we're going to do a drop. So the drop technique is a lot easier. So take a nice deep breath in and let your air all the way out. Good, easy. Breathe in and let your air out. One more. And out. Good. All right. A little flat in the thoracic spine, so flip over. Do you remember this one?
Yeah.
Okay, this is Bonnie. This is good. So sit up just like that. You're gonna cross those arms, nice and tight. Chin down. Good. You're right here. 6, 7, T1, T5. The T6 region is a little anterior, so we're gonna get in there. At least take a deep breath in. And let your air all the way out. Let your air out, and that good. Good. Not as huge as I wanted to, but it released. I know you felt that. Okay. Let's see what's going on with your neck. No headaches lately, or?
No.
Good. Okay. Any neck pain though?
Tightness.
Tightness. So occiput C1, C2. 3, 4, 5. Okay, so a little bit in the mid to lower cervical spine. So I'm gonna break out something that a lot of people really like. Break out the Y strap. Have you seen this before?
No, first time.
First time. Okay. Pick your head up for me. Put it down. Okay, good. So it's a form of traction. Okay. And anything hurts, let me know. It should feel really good. Take a nice deep breath in and let your air all the way out. Which will give you a little traction. Are you okay with this?
Yeah.
Good. 10 seconds. Let it release. Take a nice deep breath in and let your air all the way out. Good. Relax. And on the last end of the palm, give it a little bit of a tug, and you'll get a release in that neck. Okay? Breathe in. And let it all the way out. Okay.
Whew. That felt good.
That felt good.
Yeah.
Okay. Good. We'll check the rest of it. Felt that release in your neck. So that unloads the neck, takes a lot of pressure off. Stretch those ligaments. Better. Get in and manually adjust that now. Drop his head down. Drop it. Good. Down, easy, 4, 5. That was the rest of it. That's right. Okay. Stand up, sit up. Tell the camera what's different.
I'm feeling lighter,
Okay.
less pain, and I feel like I'm moving more.
It's different? Better. Okay, let's go face down and double check. All right. So that's a typical chiropractic session. And of course, if we're dealing with knee issues or shoulder issues, we'd cover those as well, but she doesn't have any of those right now. And normally we want to integrate the care with our physical therapy, or some cervical traction, or cold laser therapy, or any of the modalities that we utilize. Right now, we're just doing a full spine, old school adjustment. That's it. You know what? I still see something on that right side. I'm gonna get that SI joint because I'm not happy with the way that looks. Lay on your side facing me. This should be a baby room, so it's not gonna be as big and loud as the other one. This will just be very specific. Breathe in and let it all the way out. Drop this down. Pretty awesome. Face down. See him plotted and leave that. That's going to be a difference there. Boom. Okay. Lift that right side straight up. Good. Put it down now, left side. Money. You're done. Sit up straight.
I feel better.
Feel better?
Yeah.
5? All right, good. See you in the next video.